Welcome to the Susan Brender Show. It's all about you. Featuring shows on health and wellness, the performing arts, politics, and people who inspire you to be your very best. And now, here's Susan Brender.
I'm Susan Brender, and this is the Susan Brender Show. Today, I'm so pleased to have Amy Dayries on my show. She's a D.M.D, F.A.I.H.M, which means what, Amy?
Hi there, Susan. Thanks for having me today. D.M.D means Doctor of Medicinal Dentistry. In other words, I'm a dentist. And the F.A.I.H.M stands for a fellowship at the Academy of Integrative Health and Medicine, which just basically means if I were a physician, an M.D., I would have sat for the Integrative Medicine Board. As a dentist, I don't sit for the board, but I can hold a space for my patients about integrative medicine, which in these times is very important because our allopathic medicine doesn't always fit everybody.
I know. And you're the owner of Whole Healing Dental, which is a trailblazer, as the first dentist to complete a 2-year fellowship in integrative medicine with the Academy of Integrated Health and Medicine. And now it takes an integrated approach, as you said, to approach dentistry in a different way. You created Whole Healing Dental to share your knowledge and those of other experts in the area with fellow dentists and the public. And you are an author of the book called Solve Your Sleep for Better Health, Get to the Core of Your Snore, which I think is an adorable, if you will, cover and title of a book. How'd you come up with that?
Thank you. Actually, I do a little very local podcast in my area, and one of my people that I work with to produce my show that's called Whole Healing Radio came up with the Get to the Core of Your Snore. And he helps me come up with titles sometimes for my podcast. He's kind of got that knack. Some people have a knack for coming up with, I think, something kind of catchy that can summarize something. And hopefully people can remember, get to the core of your snore, because it rhymes.
Yeah, it does. Now, here's what I want to know. When you talk about getting to the core of your snore, why is that important for my audience to hear? Because it seems that it's a little strange that you would call it the core of your snore. Are you talking about a diet? Are you talking about, well, you tell our audience, because I'm not the expert, you are. So why the core of your snore?
Well, there's a lot of reasons you could be snoring. And it's important because we have done surveys and we estimate that about 30%, 27% actually, of our population has difficulty sleeping most nights. And we also have done surveys and realized that 73% of company leaders from around the world feel distracted some or most of the time, and they attribute that to not sleeping well. So getting to have an understanding of why you're not sleeping is the first step, really, to being able to solve your sleep. And when you sleep better, you have better health.
Yeah. Yeah. Now, regular dental care, as you say, and a good home hygiene have a direct benefit to the look of your smile. Smiles are very important. Teeth are very important. Describe to my audience, when you talk about having a benefit to your smile, how does it do that?
You mean just oral hygiene in general? How does it do that?
Correct. Yeah, that's right.
Okay. Well, oral hygiene in general is going to help you minimize, at least from your mouth, the inflammation that mouth bacteria are going to contribute to your inflammation load for your body. The other thing that a lot of people may not fully appreciate or may not have heard before is when your dentist looks in your mouth, it is really a snapshot of what's going on in your whole body with respect to your health. So we may be speaking to you about brushing your teeth and flossing, but we're helping you to try to control your inflammation load through your mouth. But more and more of us dentists are taking what I'm going to refer to as an integrative approach to dentistry. And because we realize there is a direct connection between oral health and whole body health, we're realizing we might also mention to you about taking maybe different vitamin supplements.
Yeah.
For example, we have, I think, about 23 million Americans who are taking statin drugs for heart problems.
Yeah.
And I'm not here to debate whether or not a particular person should be taking a statin drug, but what I can tell you is that one of its side effects is that it can minimize or prevent you from being able to produce as much of a natural product your body makes, which is called coenzyme Q10. Coenzyme Q10, it helps to promote circulation to your extremities. What we see is one of the side effects or one of the concerns some people have about statins is that some of the patients on statins develop diabetes later. And diabetes, one of the things you might think of with symptoms of diabetes is a tingling or numbness of extremities, or people with diabetes have poor circulation to their extremities. From a dental standpoint, people with diabetes are 3 times more likely to have gum disease. So if we see somebody on a statin, to me it behooves us to inform them that, hey, you might want to take a coenzyme Q supplement, because it might help you achieve better circulation to your extremities, because you might be at a slightly higher risk to develop diabetes and therefore also gum disease. So you see the connection? It's a big circle.
Yes. Now, let me ask you something, Amy. When people talk about, or when you talk about integrative medicine, I want you to give our audience a little understanding more of what integrative medicine is. I want a definition of it.
Okay. Integrative medicine is a combining of various medical or healthcare philosophies that come from cross professions and cross-culturally. So we're trying to see what evidence-based or what is scientifically proven to be legitimate and be helpful to various healthcare modalities.
Right.
So,
now, let me interrupt you for a second, too, because when you talk about integrative medicine and you give the definition as you just did, a lot of people they're not so sure. They like to do evidence-based things, correct? All right? I mean, it's very important that we have that kind of background. Am I correct in that?
Yes.
Now, with that said, though, again, I usually think that people, when they walk into a dentist's office, they put all their, if you will, they put everything in the hands of the dentist. They're not really aware of some of these unusual procedures or some of these unusual medicines that they have to take.
Right.
So how do you convince them? How do you convince them that this is an important way to solve the problems of the mouth?
Oh, that's a great question. There's generally not a lot of convincing that has to happen. With the background I have, I've created a lot of different handouts that cite the medical research that back up what I have to say. I can direct them to different other podcasts or websites out there, or, for instance, PubMed, which is sort of the Google search engine of current medical research. So I can show them how it's related in an efficient way. Also, a lot of times people are seeking out additional options for how to get better. Their medical insurance changes frequently these days, or their doctors come in and out of their approved systems. So they are struggling with receiving consistent care. And this is why I believe this is such a wonderful thing to offer in dentistry, because we see multiple generations of the same family in a traditional family practice. The reason I believe integrative concepts are very helpful in dentistry is because we are oftentimes the only practitioner that you might see on, over the course of your lifetime, or over a significant course of your lifetime. Maybe before you're sick, we see you in a preventative fashion. We see you maybe while you're sick, and then we see you after you've been sick a lot of times. We see multiple generations in your family a lot of times, and we're not moving around. Dentists don't really pick up and move around very often. So we're really in a wonderful position to be more and more seen as a resource for updating or informing you of different new healthcare modalities that are available. And then the other thing is we have a whole movement going on in our country. For example, it's really becoming more and more mainstream to be able to have a conversation about these modalities of health. For example, you have M.D. Anderson and some of the other military hospitals who are offering these days acupuncture clinics for the soldiers who have returned, who are suffering from post-traumatic stress disorder or who are suffering from chronic pain. And we can take those same concepts when it comes to dental phobias or chronic dental or mouth pain or temporal mandibular joint pain or trigeminal neuralgia, facial pain, and apply those to dentistry. So the mouth really isn't separate from the rest of the body. It's an integral part. And then in regards to sleep, the reason I came about writing this book is you've got to realize that the mouth is really in front of the windpipe and in front of the brainstem, and yet it's a connection between it's a way to breathe, so it's a way to receive that oxygen sustenance, and some of the same nerves that innervate the mouth, like the vagus nerve, which innervates the tongue, innervates the heart. So it's really heavily connected. It's all hooked up with how we think and how we breathe, and even relates to our heart rate.
Right. Amy, one of the things that I find extremely interesting is that you mentioned the word insurance. Now, it seems to me that a lot of people do not have insurance for dental care because somehow attention is paid more to the physical body and to and not even to the mental health.
Mm-hmm.
Now, as a dentist who's been around for a while and who really has an audience and can kind of speak up a little bit, what would you say to the insurance people? Because, again, we're talking not about a little money when we discuss dental care. If people come in and they have all kinds of problems, it costs a fortune, and it's very important that they get insurance. Now, the insurance companies, you know them. What do you want to say about why they're not really giving people an opportunity to use a good dentist?
Well, you insurance companies out there, I do wish you could also more appreciate how the mouth and the oral health is related to overall health. There are a lot of things that can be done in a preventative fashion that could heavily offset, I believe, future disease outcomes, not just about the mouth, but like I'm saying, overall with the health of the body. The insurance maximum benefits on an annual basis, when you do have even a premium policy, those maximum benefits have been really capped since the late 1970s. The best I've ever seen is about $2,000 or $2,500 on an annual basis. And if you have a broken tooth or an infected tooth, which really truly could affect your overall health, it might be hard to fully restore that in today's dollars. So I do wish we could reevaluate those maximum benefits or give people more options. There is a movement to try to start getting more people coverage through our government healthcare system, but we're going to have a long way to go, I think, before that becomes a reality for most people. On a good note, if you do preventative work, a lot of times if you can refrain from unnecessary x-rays, what is it? What's the saying? An ounce of prevention is worth a pound of cure.
Correct.
I think a lot of times a regular dental hygiene appointment might not cost you much more than a very, very nice haircut might for like women, if it's strictly just preventative. And also having a better knowledge of how dental disease happens. For example, and we talk about this in my book, Solve Your Sleep for Better Health, Get to the Core of Your Snore. We talk about mouth breathing. If you are frequently breathing with your mouth open, or you're snoring, or you breathe with your mouth open during the night when you sleep, you're actually changing the bacteria that live in your mouth. And when you change this bacteria, you're actually setting yourself up for a much higher risk of gum disease and tooth decay. So my book goes into some really simple strategies that can help you learn to breathe through your nose and actually maintain better oral health and sleep better. And This is really cool, I think, because actually you would think this is like brand new information, but some of the stuff in my book is really, really trying to shed more appreciation on some of the things that we've known about and have been researched for a number of decades in the medical community. You see, there was this Ukrainian physician named Dr. Buteyko. And if you go on YouTube or go into these PubMed studies, you'll see a lot of his work that was published decades ago. He actually passed away in the 1960s. But what he pioneered was a lot of work that showed how much carbon dioxide versus oxygen your body ought to have. And he realized that you need to hold on to at least 6% of the total air in your body needs to be carbon dioxide, because when it's less than that, you're actually going to clog up your nasal passages, making it harder to breathe through your nose. And he found that asthmatics and people that have like COPD, they oftentimes will have a history of breathing through their mouth. And so if you do some deep yoga exercises, he calls it Buteyko breathing, which is basically taking a very deep breath, holding it for as long as you can, maybe about 15 or 20 seconds if possible, and then slowly exhaling, that you will actually notice a difference in your nasal passages. You'll actually be able to begin breathing in and out of your nose more easily, generally speaking. So that's really cool. And so you start applying that to, I mean, it really makes a huge impact, Susan, on the oral health. And we've seen this in kids all the way through adults and retirees at all ages of people out there.
And, you know, Amy, I'll tell you, one of the things that I find extraordinarily important for people to know is that sleep. Okay, let's count down. Help me with this. Sleep can be controlled. Okay. Number 2, what would you say?
Sleep. It affects your ability to heal from anything. It affects your risk of getting a cold or the flu, or getting over pneumonia, or even getting pneumonia. It affects how you process fat and how you store fat, so it's attributed to obesity. And it also affects how you detox from chemical exposures. So it affects your entire metabolism. You need to be able to get deep sleep to get healing. And when we're children and we sleep deeply, that's when our growth hormone gets released and helps us to grow into the fullest height and weight and bone structure that we can. But that growth hormone actually gets released when we're adults, more in sort of a wave, a pulsed wave. And when we get that dose of growth hormone, it is like getting a hit of a healing agent. And so what we know is as we get older, a lot of us don't get the REM sleep that we could. And so there's a variety of ways that you can affect that. Sometimes through herbal medicine, like the different herb teas that you might drink before you go to bed, maybe refraining from caffeine a few hours before you go to bed, and setting up a standard bedtime routine, eliminating distractions and blue light, like watching television right before you go to bed can actually turn on and make your brain fire more, so you're not getting these deep delta waves as early into your sleep pattern. And then diet plays a role in how well you're going to sleep. But then, like I said, sleep, once you can start getting more REM sleep, you'll find you can lose weight more easily and you just don't get sick as often.
You know, it's an interesting point when you talk about sleep and you talk about all these remedies that can help it. Now, I remember years and years ago, parents used to give their kids a bottle before they went to bed, and what they would have in the bottle would be water with sugar. Now, that was so popular at that time because they thought it was going to, get the kid to sleep. Now, How has that changed? Like, let's talk about little kids now, infants and small children.
Mm-hmm.
What do you say to the parent in terms of talking about how they're going to have a great mouth and be healthy?
I would suggest you pay attention to, from the very get-go, when you bring your baby home from the hospital, if you are trying to nurse a baby and you're having trouble, seek the care of a lactation consultant. And if you're struggling, you may find out that the baby's lip or tongue are tied, which may be contributing to why they can't nurse very well. More of the scientific research is showing that there's actually a tremendous benefit to breastfeeding, because how a baby latches on and gets milk into the mouth, it's a very different tongue movement than taking a bottle. And absolutely, there's many situations where nursing all the time is not really super feasible, but when it is feasible, I encourage moms to be able to do that, even if it's just certain feeding times during the day, because you're still helping the tongue to start self-regulating and develop what we call a mature swallow. Mature swallow means that tongue graces and kind of sits up in the palate, the roof of the mouth. And developmentally speaking, between using nursing techniques where the tongue's resting in the roof of the mouth and eating harder foods instead of our Gerber baby foods or sippy cups and strained soft foods, using harder foods like raw carrots, raw vegetables, or beef jerky even, if they're not vegetarian. Those harder diets actually increase the width, the growth of the jawbone. It makes those areas stronger. So then we actually see less crowding of teeth, less need for orthodontic care, and actually better sleep that goes with this. Could I add one more thing to that? We have such an insurgence of kids who are diagnosed with ADD or ADHD or even autism. And in some cases, these kids are not sleeping, and they end up with anxiety and depression. And sometimes it actually goes back to not being able to swallow with a mature swallow and dental crowding and a reduced airway size. So they're not sleeping.
You know, nobody really even thinks about the effects of dentistry, and you're giving them a lot of information and also a lot of education. Now, what I also want to know is that we can change, as you've told me, our choice and our lifestyle so that we have a better health. Now, with that said, just take me for a couple of moments, take me through the process. Somebody comes into your office, okay? Sit down in the chair. Where do you begin? What do you say to them?
Why are you here today? And we do a full medical and dental evaluation. We go over medical history, past health problems, because we see a lot of thyroid issues, and 40% of thyroid issues can go back and be attributed to sleep problems and airway size. We see a lot of obesity and asthma, and that filters back into airway. We see a lot of crowded teeth, people who want their teeth to look better. They have gum problems. So we try to figure out if there is a link with these things back into sleep. I'm a general dental office, or I run a general dental office. So we do traditional cavities and crowns, and we can do veneers, we can do dentures, we can do implants, but this has really become a passion, because if I fix your teeth and you're not sleeping good, there's a high probability that when you come back, whenever that is, to see me, something has broken down. And I want to be able to look you in the eye and say, you know what, we did everything we could. You know we've got some things right here, and we don't want to have to fix things twice. So we go through a medical history, we figure out your why. Why are you here? And what can we help you with? We fix things, and then we look at prevention, and that's where the sleep comes in too.
Yeah, but hold on a second. Aren't you unique in that way? Because to be honest with you, I'm going to just even talk about my own situation. When I walk into a dentist's office, all they address, okay, you've got cavity here, as you said, you need a cap here, but nobody asks me about my medical records, and nobody tells me that there are possibilities to improve my sleep or anything of that nature. So aren't you unique in many ways?
I am nationally recognized as a spokesperson for the American Dental Association on these types of topics. So I'm probably different in some ways, but I believe this is going to be a tsunami of things that more and more you ought to be able to expect and ask for and, anticipate that you're going to be hearing about when you see your dentist. And the demand is going to help drive the supply of dentists who pick up onto this. But really, you deserve no less. And when you consider that you probably, a lot of you out there have had the same dentist for a long time, but how many times has your medical insurance situation shifted or changed, or the guy's not there anymore, but your dentist changes a lot less often for most people? What if that person could get educated? So we're really just starting in our dental schools to educate on these topics. As a practicing dentist for 23 years, this material is available to anyone out there. It's not more difficult for me to know this, but it makes me a much better dentist because I'm going to fix you once, not 15 times. And I think you deserve that as my patient.
Yes. Yeah. And what about, well, let's talk about senior citizens for a minute too, because often seniors have problems with their mouth as they get older, and say they're 85, 90 years old, and they come to the office. Do you think that it's necessary to do certain procedures like put all kinds of caps in their mouth and, tell them to do this, to do that when they're that old? I mean, what do you think about that?
I think it depends on where that person is. Not every 85-year-old is, in terms of health and lifespan, on the same page. You have very young people who can be 85 and people that are, generally I think you're super lucky to make it to 85, okay? But there's a wide range out there. You have some that might be still running or sprinting and winning races, and others that have been confined to a wheelchair for a long time. It's a wide range. So we try to personalize the appointment, listen to what the person wants. It's not for me to judge what you should have. I should be able to offer you all options, but then help steer you. Or I can say, my mom is actually 85. I say, my mom's 85. Here's what I would want for her. And budget, unfortunately, you brought up cost of things. Budget can make a difference in somebody's decision. But I want something practical because you could be 105 all of a sudden,
Yeah.
So, they say people are going to live longer and longer. So who am I to judge for you?
Yeah, well, you're making a very good point, Amy. So let's talk a little bit about Solve Your Sleep for Better Health, Get the Core of the Snore, the book. First of all, what is the most important part of the book? Would you suggest something that people should read before they start the whole book? And also, how did they get the book? First question. Okay. So what's the most important part of the book?
Understanding that there's multiple factors that you can actually act on with over-the-counter remedies to impact your sleep. That's the most important part of the book. You have a section on vitamins. For instance, a lot of people don't get enough vitamin D, or they don't get enough magnesium. Vitamin D you get from sunshine, or you might eat from food. But magnesium, if you are low on magnesium, and 85% of Americans are low, you're not going to be able to absorb your vitamin D. So magnesium is about $6 at the drugstore for a 2-month supply, and I usually recommend a 400 milligram dose. You take it before bed every night. It is a muscle relaxer. It helps you keep your calcium in your bones if you have osteoporosis. So if you grind your teeth or are really tense or you have restless legs, you'll sometimes see a nice improvement with this magnesium. And you're also going to absorb your vitamin D better, and vitamin D helps you sleep. It helps some of the neurochemicals in your brain that say, hey, this lady needs to sleep. You'll sleep longer and deeper. So that's one of the things you can learn about from the book, how to do this. Like I said, it walks you through different types of tea that you can drink. For somebody who has Parkinson's disorder, there are certain herbal supplements that can help maybe help downplay some of your symptoms and help delay the onset of a worsening condition, like taking vitamin B6 is one of the helpful things, because you're going to start affecting your natural chemistry with the levodopa and your natural dopamine that's in your body. So these are things you can try, and even if you don't knock it out of the park and fix everything, I really believe you'll see improvement. And then when you do see your healthcare practitioner or your dentist the next time, you can say, hey, I'm still, I'm better, or I'm not any better, but I tried this, and I tried that. So now what?
Right.
And then the book lays out a program for what you could do next. What's the next step, and what's the next step after that?
Yeah. Well, with that said, so if people want to get in touch with you, Amy, and they also want to buy your book, how do they do that?
The book is currently not available in print. It's just on digital on Amazon Kindle. So if you have a Kindle or an Amazon account, you should be able to find it listed. It's called Solve Your Sleep for Better Health, Get to the Core of Your Snore, and it's $9.99 on Kindle. It will be in print by January, and I will have it on Amazon then, and hopefully in bookstores as well.
That's right. And if people want to talk to you, they want to get in touch with you, what do they do?
Oh, I'd love it if they reached out. If they like to do email, you can reach me at Amy, A-M-Y, at, which is the at symbol, Whole Healing Dental. So that's W-H-O-L-E, Healing, H-E-A-L-I-N-G, dental.com. Or you can call me. My office number is 770-753-0067, and I'm located in Roswell, Georgia, which is a suburb of Atlanta.
I see. Well, you have a quote on your webpage which says, quote, if patients are not taught good life skills, such as healthy eating and life choices, how long can we expect our work to last? Which I think is a great way to end this program. And I want to thank you, Amy, for being on the Susan Brender Show, Amy Dayries, who is the author of Solve Your Sleep for Better Health, Get to the Core of Your Snore. Thanks for being on my show, Amy. It's been a pleasure.
Susan Brender, thank you so much for having me. I really enjoyed it, and I hope some people out there get something they can use to sleep better tonight.
Thank you for listening to The Susan Brender Show. To be a guest, email sebrender@yahoo.com.